Okay. This is a test. We are supposedly... It's working!
What? Wait. It says excellent connection.
It says that it's excellent. It's
How did that work?
Okay.
Literally, there's no internet.
So thank you guys so much for your patience. I know we're about 5 after 10. We have a hard stop at 10:30. But, like, I've been in here... So, no one cares.
Too.
No one cares how the sausage is made. But essentially, like, there is no internet on our computer. And yet, I'm still on our computer. So, I have my laptop in here. I don't know. It's witchcraft. Welcome to the Medicare Cafe. And our text line's on there and everything. I don't know. It's witchcraft.
Hold on. You got to change that one. That's the only thing I know how to do.
Welcome to the Medicare Cafe.
Hi,
Thank you guys
so
much. Sorry we're starting about 5 minutes late, but I'm telling you, it's a new year, same Olivia. That's 100% what's happening.
Does this
here.
mean it's doing anything though? Because it says nothing.
Yeah, we have this number right here shows that it's doing it.
Oh, okay.
So
I don't know why.
You know what? If you're watching this, go ahead and like either text me or
put in the chat
that you can see us and you can hear us, because I am not convinced that it is working, but I'm going to continue to try. So shoot me a text. This is my number right here at all times. You can text me whenever. This is my number. Text me if you can hear us, see us. If you can't, then we're just going to do a hell of a show that no one's going to see. Because today...
And we don't have slides.
We don't. Okay. Again, none of my stuff is working. So I have the slides that I made. And I'm going to just hope and pray that these work. But yeah. Okay. Sarah. Sarah, sorry. You're very like cryptid. It's S-G-R-O. But I know it's
I was
Sarah.
going to say.
I know it's
Sarah. Who is that?
Hey, girl.
You're related to Brandon?
I see you and hear you. Happy New Year. Are you? I don't think so. I don't think... Sarah, you're not in Missouri. Do you know a Brandon Giroux? I know that. I don't think they're related.
It's not a super common last name.
I know it, but welcome,
Brian, we're late.
I know, Brian. If you watched from the beginning, I was telling you that I'm late. Anyways, what we're doing today, again, we don't have slides because everything is chaotic. Today, you can see our slides here.
Hold them up.
Aren't they beautiful?
AEP.
We're talking about
OEP.
OEP. We're talking about OEP, the do's and do nots of OEP. It's pretty easy, but we gotta go quick because we're starting late. And then I want to talk to you. And they're
related.
Cousins. Okay, well there you go.
Too funny.
We want to talk about the do's and don'ts of OEP, because obviously OEP is right now. It is January 1st. Through March 31st. Just a reminder, during this time, you can help anybody with an existing Medicare Advantage plan that was effective yesterday, January 1st. And just a reminder that Medicare supplements, this doesn't affect anybody on a Medicare supplement or PDP plan.
And if you're currently enrolled.
Exactly. And like a big confusion is people are like, oh, well, they had this plan from like 2 years ago. They just stayed on it through their third year. No, they still qualify. It doesn't have to be a new plan January 1st. They just have to be on a Medicare Advantage plan on January 1st. But remember, your MedSup people, if you're trying to move them to a MedSup, they still have to go through underwriting. So...
But you can't, even if they went through underwriting, you can't write a PDP at this time.
Yes, you can. Yeah.
During OEP?
OEP. You can write an OEP, you can write from a person from a Medicare Advantage plan to another Medicare Advantage plan, or you can write them from a Medicare Advantage plan to a standalone PDP plan, which would disenroll them from their Medicare Advantage plan.
What?
So you can disenroll. That's always been the rule.
No.
That's always been the rule. You can you can disenroll somebody during OEP from a Medicare Advantage plan.
My mind is actually blown right
now. Yeah, that's like one of the reasons why we tell people if you're wanting to take someone from a Medicare Advantage to a MedSup, doing it during AEP is fine, but you still have to underwrite them. So just wait, and if it's coming like close to the end of the period, just wait until OEP, because then you have 3 months to do it.
So the election period, is it just like an OEP election period
it's just
for
OEP.
The PDP?
Yeah, and you write a PDP. It doesn't count if they were already on a PDP. If they're on a Medicare Advantage plan.
Anyone else out there that did not know that?
If you don't,
I feel like I need to just
feel better about that. No, that's the case. Say hi, Sherry. Thank you. No, if you are on a Medicare Advantage plan, you can either enroll one more time into a different Medicare Advantage plan or disenroll from the Medicare Advantage plan by enrolling into a standalone PDP.
See, this is my problem. I used 3 election periods. It's turning 65, new to Medicare, or leaving group coverage.
Yeah. Wow.
And I need,
and
and
don't get confused. There's now 2 different OEPs.
I
Medicare
know.
Advantage. Oh,
the OEP
Don't do that.
delayed
Okay.
Part B.
Yeah, there's an
Or the OSEP. Oh, sorry. I was thinking of the ISEP.
No. There's an OEP that like whenever I keep looking at that camera. You're here. You were that camera now.
No, it's not.
No, it's not that camera. Is it this camera?
Yes, that's what's streaming. See, look at your finger.
What is happening? Anyways, okay. Well, I'll just turn that then. Sorry. Okay, I'm fine. But when it comes to again like OEP, there's 2 different OEPs, not including the MedSup OEP. There's an OEP that happens the first 3 months you enroll into a Medicare Advantage plan, and then there's another OEP that happens January 1st through March 31st.
There's an OEP 3 months after you sign up for an Advantage plan.
Yeah. It's nuts, okay? So first of all, because I know we have a limited amount of time, and
My name's Kari, and I'm new at this.
I'm new here. Hi. No, that OEP is actually pretty new. I think that came out like 2021, but no one knows about it. I didn't learn about it until last year. Yeah, like, it's nuts. I can say last year because it's Jane. Oh, so Happy New Year. Welcome to 2024.
I said Happy New Year.
I know, I didn't. I was a little frazzled.
I don't know. Brian being Brian.
I love Brian. So first thing, like the do's and don'ts of OEP. Number 1 is the biggest one. Do not launch a marketing, and by marketing, I really mean prospecting campaign around OEP. You cannot prospect and like market that it's OEP. You still have time to move. You can't market it as like an extended period AEP. So basically, you cannot prospect with the intent of using OEP as the election. And people get really stuck on that because that can be really scary. It's
pretty different from AEP.
It's different from everything. Yeah. You can mark, and it's all about, and when it comes down to compliance, it's all about intent. If you're reaching out to somebody who is not your current client, aka prospecting, if you are prospecting with the intent of saying, like, I'm going to talk to them and I'm going to use OEP, that's one thing. If somebody reaches out to you and is asking you for help and things like that, you can absolutely mention OEP, talk to them about it, but you just can't go advertising, hey, there's still time.
I love that you say that over and over because I need to hear it, that it's about your intent.
It is intent.
Because, like, mistakes happen. Oh, yeah. They happen during AEP, and I would, like, me, the rule follower, like, I would stress about it, and then I was like, my intentions were good.
I was trying so hard.
My intentions were good.
They're gonna, like...
It wasn't 48 hours, but my intentions were good.
You're gonna be sent to jail, and the guy next to you is gonna be like, what you in for?
Like, I didn't get disqualified after 40...
Before
48 hours.
Before 48 hours. However, on the alternative of that, something to do during OEP is letting your current clients know they have the option to move one more time if they are unhappy. So it's not Fight Club. It's not like don't talk about it, don't think about it. It's not what that is. It's all about, are they prospecting? Are you trying to get new clients with that as the intent? But you can absolutely educate your current clients. Yes.
I did that a lot, I feel like, during AEP.
I also, we all know that we all follow the rules. I would also recommend that you, prep your clients, know that, hey, it's very likely. I've gotten 3 calls, over the last couple weeks of people being like, hey, my clients are getting called talking about OEP and saying that they're with my office. They'll say, oh, are you, somebody will call your clients.
How do they know that they're...
Because they'll say, oh, I use Kari. I like Kari. I use Kari with Senior Benefit Services. And they say, oh, I'm with Kari. I'm calling on behalf of Kari. I've gotten 3 calls. That's always been. I've heard that every single year, but it happens during these times like OEP.
How can they do that?
I mean, they can't. It's illegal, but bad people exist.
Yeah, true.
I mean, that's the whole thing. So,
true.
So also prep your clients, letting them know that hey, the calls may still happen, but if you're not, make sure it's also a really good time to in your marketing, your newsletter, your campaigning, to do a reminder of hey, here's who's in my office. If you're talking to somebody and they're not on this list, hang up the phone and call me immediately, right?
Yeah.
All right, the next don't I have for you. Kind of talked about this already, but during AEP, do not write a PDP before the Medicare supplement is approved. Because again, during this time, not news to Kari at all. She knew this for forever. But during the open enrollment period, you can enroll somebody in a standalone drug plan, which disenrolls them. But the thing is called, they put them back on original Medicare. They can't go back to original Medicare. But make sure that they are approved on that Medicare supplement before you do so. Because if you submit that PDP application, that will knock them off that Medicare Advantage plan. And if they can't qualify for a Medicare supplement, then you now have them on original Medicare, a prescription drug plan, and no other coverage. Which is not as good as a Medicare Advantage plan.
No.
So just make sure, like, give yourself plenty of time. If you want to make sure, you know, be extra careful, do the med set for, obviously, the earliest is February 1st. But if you don't hear back from them, then push it back another month because you don't want to, it's better to be extra cautious during this time. For sure. The next do that I have is just keep up with your normal marketing. People get really nervous whenever they see a bunch of rules. It's like, don't market OEP, no marketing during OEP. You can still do everything
market yourself, else. Yeah.
Yes, it doesn't change anything except for just don't do a big campaign that's like, you still have time to change. Call me for details. Don't do that.
Can I do, in my videos, I can do an educational about, like, what OEP is.
Yeah, we're going to talk about that.
Right?
Yes. Okay. Yes. You can absolutely educate about OEP, but you just have to be, well, that's my next do. We'll get there.
Okay.
But yeah. On ya. No, I love it. It means, like, same brain, you know. My meaner half doesn't operate on the intent rule. Appreciate you, Brian. But yeah, it's all about, like, you're turning 65, keep doing your seminars, keep doing everything. Nothing else should stop, but just knowing that if you do come across a prospect that's unhappy with their circumstances, unhappy with their networks, unhappy with their pharmacy,
there is an opportunity.
To move them. So it's a tool. It's not a prospecting tool, though.
Or if there's, like, and you said with your current clients, there are some clients that I didn't get to, not because I didn't try to reach out to them, but I will also try to reach back out to them during OEP.
Yeah. I mean, and that's where, like, what we tell people, if they're on a Medicare Advantage plan, I use OEP as, like, the let's fix some issues, let's fix some mistakes.
Yes.
What it shouldn't be, and this is something I should have as a don't. My next don't is don't overthink it. But I'm also going to put in here, don't abuse OEP. Because a lot of people, what a lot of the carriers are scared of, especially the carriers that have, like, these really intense, you know, full dentures, thousands of dollars of dental, the Aetna, like the golf memberships, things like that. Like, people, like, the really rich benefits, what carriers are really scared of is that people are going to use those benefits and then bail. Right. I highly do not recommend that as an agent.
How can they?
Because they use OEP, they get all those benefits.
But there should be a rule against that somehow.
So here's the thing.
Because, like, the donut hole rule doesn't.
No, but this isn't CMS stuff. It's carrier stuff. CMS isn't providing gym memberships and golf memberships and tennis shoes. CMS isn't doing that. It's the carrier. It is not in your best interest as an agent to do that, though. It looks good on paper. You think, like, oh, I'm going to get the best for my clients. It is not in your best interest because there's something called rapid disenrollment, which is a CMS violation. So if you have enrolled somebody in a Medicare Advantage plan and they disenroll from that Medicare Advantage plan within 90 days or 3 months from it being effective, that is considered rapid disenrollment. And if it happens to a handful of clients, because it does happen, that's what OEP is for. If it happens, it's not a big deal. But if it happens to the majority of a book of business with a carrier, it's a CMS violation. It is compliance. And you know, we have seen people get called and saying, like, hey, we're seeing a lot of rapid disenrollments from them. Yeah. So it's not in your best interest. A lot of people have been trying to get smart and sly around it. Don't do it. Don't do it.
Don't be sneaky.
Yeah. So don't do that. But my other don't is, again, don't overthink it. All you have to know is focus on your intent. If your intent of reaching out to an individual is saying that I have an extra chance to enroll them to a new plan, that's intent. You can't prospect that way. But I think this is my last do. My last do is what you should be doing during OEP is exactly what you talked about.
There we go.
Using your social media or your newsletter or any kind of broadcast marketing that you have to educate.
Yep.
The only thing is what's the difference between education and prospecting is the call to action.
For sure.
If your call to action is you can move right now, call me and set an appointment, that's your prospecting.
Yeah.
But if your call to action is if you have questions, you know, feel free to give me a call, things like that. But, like, just make sure your call to action isn't let's set an appointment to talk about OEP.
So that was I told you every week I do, like, a client question of the week.
Yes.
And that's what my client question of the week this week is, what is OEP? That was my plan.
No, but and you can.
I wanted to double check I could do that.
That is 100% completely fine for you to do. As long as you're call to action isn't call me to set an appointment to talk about your options.
Yeah, no.
That's fine. Don't do that. But if yours is just like, hey, this is what OEP is, this is what it means, this is who it affects. Mm-hmm. If you have any questions about that, reach out to me, my team. All good.
There we go.
Yeah. So do educate, do talk to your clients, do make sure they understand. And again, like the biggest thing is communication is key to this. Setting expectations are key. It is very likely your clients will continue to get cold called, will continue to be reached out to, because not everybody is as upstanding as the crew here on the cafe and the team.
And gotta remember, they can only make one change.
It is one change, yes.
One change.
Mm-hmm. So once that application becomes effective, they're done. They've used their OEP election, and they're good. Also, keep in mind that the LIS, the Medicaid LIS SEPs open back up.
Yep.
So we can continue to use LIS and Medicaid.
I had somebody call me about that this morning.
Yeah. It's gotten a lot of questions about that. So
I feel like this is totally off topic, but it was my LIS client that called this morning.
I didn't know there was a topic.
I had a ton of, during AEP, at least more than usual, like super expensive brand name drugs that were like, we're talking like tier 5, tier 6, like not on the plan. Mm-hmm. And almost all of them were like $10 copays on their group plan.
Yeah.
And then, those end once you're eligible for government insurance.
Mm-hmm.
And some of them on Needy Meds will have a drug manufacturer discount.
Yeah.
But I had like 10 that don't.
Yeah.
And it just sucks. Like there's nothing else to do from that except with this one this morning, we're going to apply for LIS.
Yeah.
Extra help. But
well, you can thank the Inflation Reduction Act for that.
I know.
Yeah.
Like I don't.
Funny how that works. About again, like I'm not gonna get on a soapbox here, but it's funny how like, these insurance companies are for profit. So when you make them have to pay for things, it's funny how that ends up going to the client because they are for profit. So yeah.
So the whole like 10 drugs that are gonna be, and maybe we can have a topic on this someday.
Yeah, we should.
But the 10 drugs that are supposed to be negotiated, we don't have any prices on those yet, right?
No, because those negotiations, I
thought they start in January,
They do. We ought to have Chalon Jackson. He is our compliance officer. He's also like, that kid reads legislation for fun, right? So he's like the perfect person to kind of talk about this stuff and say like, this is what's happening. This is what you should be doing. This is what you should be aware of. This is how it affects you. Also, you should be watching the Medicare Insider. We have our team, Rachel Brandmeier and Chalon Jackson do a podcast. They release it every week, and it's called the Medicare Insider, and it talks about like what's legislation's going on, how will it affect agents, how will it affect clients. So you can find that on Senior Marketing Specialist website, smsteam.net. You can also find it on our Facebook and our YouTube pages here as well. But yeah, they get together and they'll talk about like, here's the legislation that came through. This is how it affects you. This is how it affects your business. This is how it affects our industry. This is how it affects your clients.
Because I feel like in theory, yeah, that sounds awesome that Eliquis and Xarelto are going to be cheaper.
Right.
But I feel like they're still going to get their money some other way.
There's
going to be more drugs, I feel like, off the formularies.
And we saw that this year. Formularies went through a significant changing. Pricing went through significant changing.
And so I just feel like
they're bringing back deductibles on certain tiers. Like, I mean, like, and it's not, and we're not done. We're not done. So if you're interested about how that's going to affect, I know they've done an episode on this exact topics, a few of them. So check out that podcast. It's for sure worth it. But anyways, guys, that's what we have for OEP, the do's and don'ts. Since we're talking about legislation, since we're talking about that, you guys may have been seeing some things circulating. I
want to know more about it.
So we all know and we all know that senior marketing specialists, we've been pretty quiet about what's been going on. The proposed changes to the 2025 CMS regulations, one of which is basically saying that they're going to be getting rid of all administrative costs, including HRAs, BBEs, and overrides at the FMO level and overrides at agency level. So no more overrides. So I
don't even know what an override is.
That is basically when an agent partners with an FMO, basically the carrier pays the FMO to service that agent and is paid off of a per app basis. So every time an agent writes an app, it doesn't take away from an agent's commission. The carrier will just repay the FMO or the upline. It pays every single upline in that hierarchy up to the FMO for saying like, hey, thank you for taking care of this agent who's taking care of these clients. This new proposed rule is saying that they will eliminate all administrative costs, which includes override commissions. That includes your VBE. It would include anybody who's receiving any marketing bonuses, anybody who's receiving anything that is above the CMS, you're allowed to get paid this, anything above that would be eliminated, which would take FMOs away. It would basically say that an FMO is not allowed to be a part of the selling process. So if you like Medicare Center, if you like CSG, if you like quoting, if you like people in getting help for compliance and guidance, if you like people to help you with your seminars, if you have any help from an FMO, if this ruling goes through, that would end.
Yeah.
And so that's what is going on right now. So that's what we've been really quiet about this. We've actually been waiting for Integrity and their legal power and what they're doing to say, like, this is what our game plan is. So what's really interesting is that the huge leaders in our industry, we're talking Brian Adams, Dwayne, we're talking about from SM Sales, we're talking about from AmeriLife. These industry leaders got together and they started this coalition called the Americans for Beneficiary Choices. And what it is a coalition, and again, it's not an integrity coalition. It's all the big powerhouses, all the big FMOs coming together and trying to fight this going through.
Okay.
And trying to make sure that FMOs can continue to help agents. Because what this is, again, it's a significant step that would, again, eliminate FMO guidance, eliminate FMO resources. But it's also a significant step to say to agents of saying, like, do agents need to be a part of the buying process when it comes to Medicare Advantage? I mean, this is a significant thing that brings that in question. So we're posting it. You might be seeing, I posted it last week. Clayton Clemens is going to be posting it again today. But
Brian's writing his congressman now.
Yes, it is. We have until January 5th to give comment on this.
Oh.
And so that's Friday. Yeah. We have until Friday to comment on this. And so the Americans for Beneficiary Choices has put together some resources to help you write the letter. There's a petition going out that's requiring thousands and thousands of signatures. Essentially what we're trying to do is be so loud that we can't be ignored.
Right.
So we're encouraging family, we're encouraging agents, we're encouraging FMOs, we're encouraging your beneficiaries, anybody who is touched by this, to write a letter or to sign the petition to basically say that this isn't okay. Because agents and FMOs obviously play a huge part in helping people choose their health insurance. For sure. Because everything else out there is so misleading. And so please, we're asking everybody, sign the petition.
Sign it.
Write the letters. There's, again, on that website that we're posting, there are guidelines on how to help you construct that letter. There's even like a pre-made letter that you just kind of edit yourself and like add your name, add how many clients you're serving annually. So they're trying to make it as easy as possible. But it is a serious, this isn't the first time this has been proposed.
Oh, really?
But it's the first time it's gotten this far. Like about every 5 years this comes up, and it's something that they talk about, but it's not gotten this much attention.
So just leave everybody to their own.
It's essentially what they're saying is like, oh, people can do this on healthcare.gov. Like, right? So many people don't require insurance agents to use healthcare.gov. Medicare.gov should be being able to do that same thing. And we obviously know every single reason why that's incorrect.
Right.
Every single reason why that's incorrect. If you are somebody that's like, oh, who cares? It's just the FMO. Like, it doesn't affect me. One, find a new FMO, because if you're not finding value in your FMO, then you have a bad FMO. But two, again, this is a significant step that CMS is basically saying, or not even CMS, but like that's being proposed, that agents don't need to be a part of that equation. So it's really important. It's incredibly imperative that we do this the right way. We know as insurance agents, we provide so much value. I don't need to go and slander. I don't need to go and write ridiculous Facebook posts. I need to just show and continue to show the value that insurance agents have.
And even if it's for the small income you get from the HRA.
I know.
I'd like to keep those.
If you enjoy,
it's all of that.
If you enjoy being able to have United Healthcare pay for your seminars that you're doing,
Yeah.
Just even like the seminars, because it's marketing dollars. If
Mm-hmm.
you enjoy co-oping with United Healthcare or Aetna or Humana to do seminars, that's going to stop if this goes through. So just again, if you have questions on it, there's a ton of information out there. I encourage you to visit. We're going to be posting the website. I posted it last week. We'll be posting it again today. But it's called, again, the Coalition is American for Beneficiary Choices. I highly encourage you to check them out. It's very impressive what they're doing and the charge that they're leading on this. But again, it's coming from the industry giants, not just Integrity, but from the industry. So it's really cool to see competitors get together for such a great cause. And I'm really excited to be a part of that as well.
Sign it.
So sign it, do it. We got to get out of here. Any, Terry, I know you had a question. Terry said, oh, sign. Thank you, Terry. We got to go real quick, but he says, if you do a cancer ad, can I mention Medicare ad at all? I saw this morning that Missouri is not going to tax Social Security anymore. So if you're going to do, my recommendation would be, is you can mention Medicare on there, but no Medicare Advantage, no Medicare plans, nothing like no dollar amount. Just if you're saying, and again, Terry, send it to us. We'll look it over and tell you if it's okay or not. Mm-hmm. That's just like the best answer I can give you. Send it to me. We'll take a look at it. It is 10:30. You have a 10:30 call. You have a 10:30 call. So I can take it in my car. We have to go. But I just want to say thank you guys so much for your support. Have an amazing new year. Have a wonderful time setting your goals. Call us. We are here to help you with anything that we possibly can. Any final comments? Sign the damn thing.
So. Sign it.
Send your letters.
Yep.
Let us know how we can help.
That's it.
All right. All right, guys. So until next time, have fun.
Make money.
And give impeccable service.